All right, so we have a 78-year-old mother who was supposedly getting slightly mentally confused, and the daughter called and said, I think my mother has a UTI because she's confused, mentally confused. No, she's otherwise okay, but today she sounds confused and I think she has a UTI. Now, this is a big problem. This is when people think that a bladder infection is causing this mental confusion. Now, in very few cases that could be the case, but in most women, no matter the age, most women, if it's a urinary tract infection, they will have bladder symptoms. They will have urgency, frequency, new onset urine leakage. Something in that bladder area will be happening. It's not just mental confusion. In fact, if it's only mental confusion, you have to rule out some other causes and not just count on the bladder. Most patients will have bladder symptoms. It is a misperception that the elderly patients will first symptom they'll have is mental confusion. Not true. That means the first symptoms of a urinary tract infection. You must rule out, the doctor must rule out other conditions and not just treat for a bladder infection. The most important thing is, does she have any localized bladder symptoms like urgency, frequency, burning, anything there, cloudy urine, foul smelling urine, blood in the urine, anything there. If there's nothing locally, then this is unlikely to be a urinary tract infection. Because if you send this patient's urine and she has no bladder symptoms, it'll come up as asymptomatic bacteriuria. That means there'll be bacteria present and she'll be wrongly treated with an antibiotic.